This is the epicenter of an Ebola outbreak. We've been given exclusive access, and the first thing we find out is that our safety protection isn't enough.
Now, the reason this isn't acceptable outer safety equipment is because it's this cotton-like material, and obviously, fluids, which are a key risk in contracting Ebola, can get sort of soaked into the material. Let's keep going.
Right. What we've got is pre-packed kit. Within here, there's various bits of kit.
The virus is so deadly, you need extreme protection.
If you're inside the kind of restricted area, no matter what you're doing, you have to wear something like this.
You should do, yes.
Plastic overalls, aprons, hoods and a face mask. Not a single inch of skin can be exposed. Touching fluids, a patient, or even an object can put you at risk. We're inside Kagadi Hospital. When the first case was confirmed in late July, the rest of the patients fled, and health workers were some of the first to die.
Early on in the epidemic, then they're often in contact with patients, and then unwittingly, if they don't know it's Ebola, they may catch it themselves and then transmit that to the community. If you can't do that, you can rip it.
Within 24 hours of the first case, Doctors Without Borders was on the ground. There is no cure for Ebola, and up to 90% of the people who catch it will die. So managing the fear factor is key.
We use a lot of chlorinated water.
Olympia De La Rosa is in charge of the response. She says it's important to stay calm when entering the high-risk zone. This is the innermost exclusion zone. 30 suspected cases of Ebola, 2 confirmed. The sickest too dangerous for us to get close enough to film. There is no treatment. All the doctors can do is give care. All the patients can do is hope. Doctors wear protection for themselves and to contain the outbreak.
The main objective when one of these outbreaks blasts is to contain the spread, because we cannot give a treatment to the patient, and we cannot give a vaccine or any prevention to avoid that it appears. So we must contain the spread of the disease.
We're allowed only a few minutes inside and have to leave. It's the front line of the fight against the Ebola outbreak. So no risk is worth taking. The goal, to stop the spread in Uganda and even beyond. Dave McKenzie, CNN, Kagadi, Uganda.